So it's my pleasure to introduce the presenters we have lined up today. My name is Ruwaida Salem, and I'm the current Managing Editor of Global Health Science and Practice, and I'm a Senior Program Officer at the Johns Hopkins Center for Communication Programs, or CCP, where I have managed and implemented diverse knowledge management initiatives. We also have with us today Debora Freitas López. She is the Executive Director of Johns Hopkins CCP. Debora is a global leader in social and behavior change with broad-based experience leading programs in both the health and non-health sectors across Africa, Asia, Latin America, and the Caribbean, and the Middle East. We also have Dr. Steve Hodgins. Steve is GHSP's Editor-in-Chief. Steve is a family physician by training with an MSc and DRPH in health behavior and public health leadership. For the past 20 years, he has worked in global public health programs, and he's currently an associate professor in the School of Public Health at the University of Alberta in Canada. We also have with us Dr. Susan Ontiri. Susan is an associate editor with Global Health Science and Practice. She's a public health specialist and a researcher, and she's currently serving as the country director of the International Center for Reproductive Health Kenya, where she leads a diverse portfolio of more than 10 research programs and interventions across many different health areas. Next slide. So our plan for today is Debora will start by providing some opening remarks on behalf of Johns Hopkins CCP. Steve will then provide a bit of background about GHSP for those who may be a little bit newer to GHSP, and we hope that this will serve as a good refresher as well for our close friends and colleagues. Susan will then give us a glimpse into what GHSP has been able to achieve in the 10+ years since we launched the journal. And then I will wrap up the webinar with an overview of next steps for the journal. We'll also make sure that we have time to answer your questions. Thank you actually to all those who submitted your wonderful questions on the Zoom registration page. We took note of those and we'll address the common questions that came up during the presentation. We also have the Q&A portion on the Zoom ready and waiting for your questions. So please pose any questions that you have throughout the webinar in the Q&A portion of Zoom. And we'll also make sure that we have time at the end of our presentations to answer those questions. We have scheduled this webinar for 45 minutes. The appointment may have shown up as an hour on your calendars, but we will try to wrap everything up in 45 minutes. Next slide. So first up, I would like to ask Debora to start us off by providing her opening comments. Debora, over to you.
Thank you. Next slide. So hello, everybody. I am so excited to be here, and I hope you are too. Just to talk a little bit about CCP and also about the journal. GHSP is published by the Johns Hopkins Center for Communication Program, as Ruwaida noted, which is situated in the Johns Hopkins Bloomberg School of Public Health. And in particular, CCP is part of the Health, Behavior, and Society Department. At the center, we harness the power of communication to save lives. Our key areas of expertise include social and behavior change, knowledge management, applied research. And CCP runs the gamut from family planning to malaria and can be adapted to nearly any other field. And we have worked around the world in Africa, Asia, and the Americas, reaching over 1 billion people with our messages and to encourage healthy behaviors and well-being. Next slide. So CCP is quite excited and proud to be the publisher of the Global Health Science and Practice Journal since its inception in 2013. We have worked in collaboration with many individuals on our editorial board who represent a range of organizations. And we are proud today to relaunch the journal and share a commitment to maintaining GHSP as an independent journal that can continue to benefit public health implementers and researchers around the world. While the loss of USAID support in February of this year has put the journal at risk, the center is committed to exploring ways to sustain it, ideally without imposing fees on authors and readers. And there are three main reasons why we think the journal is an essential global good. First, GHSP has been a valuable resource for 12 years, benefiting program implementers, researchers, policymakers, and many others in over 210 countries with free and open access to critical global health knowledge. The journal receives 1.5 million articles accesses each year, and the articles are cited widely in other peer-reviewed literature, as well as in policy documents, news articles, and on social media. More importantly, our readers put the program knowledge from GHSP articles into practice. We have many stories of how readers have used GHSP to enhance programs, generate new research, and even formulate policy. Second, GHSP is not like other peer-reviewed research journals. GHSP focuses on sharing evidence and insights from real-world global health programs rather than theoretical research that is typically reported in journals. GHSP also prioritizes the voices and experiences of implementers and researchers all over the world, including in LMICs, with 60% of GHSP authors coming from low and middle income countries. Last but not least, we think GHSP serves an essential and urgent need in the current global context. As governments, NGOs, funding agencies, and other stakeholders are adjusting to the rapidly changing landscape, this journal provides an essential opportunity to document and share these experiences. Now, before I turn it over to the other panelists, I want to take this opportunity to personally thank Steve, GHSP's editor-in-chief, for his continued support and engagement with the journal, as well as the entire team of associate editors, authors, reviewers, and readers who have rallied behind GHSP, many of whom have stepped up to contribute their ideas and even their resources to sustain the journal. I also want to thank our managing editor, Ruwaida, for taking the lead and supporting the team as well. Over to you, Ruwaida.
Thank you so much, Debora. Thanks for those great opening comments, and we appreciate your time and being here as well. Next, we'd like to ask Steve to come on board and share some background about GHSP, including our goals and scopes of the journal.
Thanks, Ruwaida. Next slide. Okay, I'd like to pick up on some of the points that Debora made. There have been a number of other global health journals that have come out since Global Health Science and Practice was initially launched some 12 years ago under the leadership of founding editor Jim Shelton. And there are some good journals out there, but Global Health Science and Practice fills a particular niche. We focus on practice-based evidence, on the lessons from implementing actual programs, especially at scale, in addition to communicating research evidence to inform practice, which has been the key focus of other global health journals. For us, relevance to practice is key. At Global Health Science and Practice, we certainly care about rigor, and we apply standards similar to other journals, but our editorial approach recognizes that there are various kinds of evidence that are relevant to public health work as we seek to understand actual programs in the real world and what it takes to make them stronger. For the last several years, we've been publishing program case studies as part of our effort to capture and disseminate such learning. Our journal also gives those in public health practice, not just researchers, especially those based in low and middle income countries, a platform to share knowledge on the how of program implementation. We provide a platform for program managers and implementers who are often shut out of the scientific publishing field to share evidence and experience from programs operating under real-world conditions, and to do so with sufficient rigor to inform efforts elsewhere. Next slide. We cover a broad range of health topics, and here we've listed those most heavily represented in our pages, as well as other topics that we've been prioritizing in recent years. Next slide. So that's a little bit of background about the scope and aims of the journal. I also want to share a little bit about how we operate as a team behind the scenes. We have quite a large group of dedicated volunteer editors who meet regularly online and contribute their time to review and to assess papers and to help make decisions about their appropriateness for publication in the journal. This team has been largely kept intact, even with the USAID funding cuts. We're excited to share that we've brought on one new associate editor, John Barrazzo, and we also have a new managing editor, Ruwaida Salem. While she's new to this specific role, she's been involved in the journal since its inception, first helping to get all our systems and platforms in place, and then serving as the technical editor for the journal for several years. Next slide. One aspect of the journal that's of particularly importance to us has been our efforts to address some of the power imbalances in global health and in global health publishing more specifically, also recognizing that there's still more for us to do. From the beginning, our model has been diamond open access. We don't charge fees to either readers or authors. We also do our best to mentor and support authors from LMICs who've not had much experience writing for the peer-reviewed literature to get their manuscripts in good shape for peer review. Since 2020, we've had an explicit policy to which we've held ourselves accountable to ensure that articles reporting on research or programs conducted in a particular country or countries have authors from those countries. And since that time, we've been tracking data to ensure that we're making progress. As we see in this figure, we've been making meaningful progress in increasing representation of such authors. Related to this effort, we've also sought broader regional perspective within our editorial team, recruiting several newer members. Susan Ontiri, who we'll be hearing from shortly, who's based in Kenya, and then Rajni Vaid, who's based in Delhi, in India. Next slide. So I'd also like to clarify that while Global Health Science and Practice was supported by USAID over the period since its inception through to earlier this year, it was never intended to be just a publishing arm for USAID. Instead, the vision was to share experiences from diverse actors so that everyone could benefit from each other's experience and learning. So while a significant proportion, a little over a third of our published articles were about projects or research funded by USAID, a substantial portion reported on research or projects funded by other entities. What's shown here is our best estimate of the funding sources based on information provided in the articles that we've received and published. We've determined, for example, that about 15% of our articles reported on projects or research funded by the Gates Foundation. We've also had many articles connected with other bilateral funding agencies, other private aid foundations, UN bodies, including WHO, UNICEF, UNFPA, and multilateral financing mechanisms, notably Gavi and the Global Fund. As a final comment, we're now facing a changed context in global health with a shrinking role for official development assistance. That will make space for what Michael Woolcock refers to as national development, that is to say, for governments and their partners in country. But I'm convinced that there's a continuing need for strong, effective programs to improve health outcomes at scale, and this can best be accomplished by sharing what we're learning from our programs and learning from others facing similar challenges. That's what global health science and practice is all about, past, present, and future. Thanks. To you, Ruwaida.
Thank you, Steve, so much for that. Really appreciate your background on GHSP and a peek into what you think the future for GHSP holds. Next, I'd like to ask Susan to provide an overview on what GHSP has achieved so far.
Thanks, Ruwaida. So GHSP is regarded as a must-read journal for global health professionals. The journal receives more than 1.5 million articles views per year, or over 100,000 views a month. GHSP's standing in the field is further affirmed by its frequent citation alongside prestigious publications like the Lancet Global Health and the Bulletin of the World Health Organization. The journal's impact factor of 2 also places it on par with other leading global health journals. However, we think citations are also somewhat of an echo chamber, with the literature referencing itself whether or not it's having a useful impact in the real world. We are more concerned with real-world impact. Our primary goal is to measure whether our articles are truly influencing policy and practice. In other words, are program stakeholders picking up the lessons documented through GHSP and putting them into practice in policy and programs? Next slide. In a survey of our readers and authors that we conducted in 2024, we found that a large majority of those surveyed say that they are in fact up from GHSP articles to use in other contexts. Slightly more than 3/4 say they use information from GHSP articles to inform their global health work, to do things like guide their research or learning agenda, design new or improve existing programs, revise training materials, and update policy or guidelines. There were more than 800 respondents in the survey from 28 countries, with 55 of them being from low, middle, and income countries. Next. Nearly all respondents confirmed that GHSP is relevant to their public health work, citing its unique emphasis on practical program knowledge over theoretical research compared with other journals. For instance, an author from Pakistan noted, "What really attracted me to GHSP is the focus on implementation. Usually, global health journals cover the problem and prospective solution, but not an actual strategic plan and the implementation of that plan. It's not just about something that can be done, but something that has been done." Next. Respondents also shared how important it was that GHSP was open and free for both readers and authors. For example, readers highlighted the importance of putting a premium on scientific knowledge over monetary gain. Again, another author and reader from Nigeria noted that the journal gives more premium to scientific knowledge than monetary gains from authors. Hence, it does not charge authors for publication. It is obvious that some relevant works have not come to the public knowledge due to the high cost of publication charged by other journals. But to GHSP, it is different. Respondents also shared how important it was to flatten the power dynamics in global health. A reader from the United Kingdom noted, "It's the only journal with a status that is truly flattening the power dynamics of global health engagement, such that everyone has a fair chance and is able to create new things from shared ideas." So those are just some feedback and insights that we got from our readers to basically underscore the relevance and importance of this journal within global health. Back to you, Ruwaida.
Thank you so much, Susan, for sharing those quotes. I always find it so helpful to hear from people's own words, how things have made an impact on them. Next, I'd like to talk us through our next steps for the journal, including our Keep GHSP Open campaign. Next slide. So first, I wanted to provide an overview of how we'll be prioritizing author and manuscripts over the next several months. I know this is a key issue that's on the mind of our authors right now, and rightly so. So as many of you may know, we published our first issue independent of USAID support several weeks ago in August. And if you haven't had a chance to look through the issue, we definitely encourage you to do so. We have published a wide variety of articles covering a range of health topics, from menstrual health to antenatal care, to cervical cancer screening and HIV prevention, and more. So we'll drop the link to our current issue in the chat in case you haven't had a chance to look at that. So with the publication of that August issue, we reopened our operations, starting first with the existing articles in our pipeline. And the reason being of us focusing on the existing articles in our pipeline is that we really wanted to be good stewards of the papers that have been submitted to our journal. And we acknowledge that these authors have been waiting for quite some time to have their papers processed through our system. So we want to make sure that now that we've reopened our operations, that we concentrate our time and resources on getting those papers through the process and to clear decision points. So we have articles at different milestones throughout the submission, peer review, and publication process. From those that had just been submitted and that needed to be screened by our editors right before the stop work order from USAID, to those that were in the midst of getting peer reviewed. Some had completed peer review and needed to be revised, and still others had already been accepted but needed to be edited and laid out. So we are going to prioritize those papers that were closest to being published and then work backwards from there. And I know many of you have been in touch with me, and I've confirmed that your papers are still in the queue and that I'll be in touch with you as soon as possible. And I really thank you for your continued patience. It is taking us a little bit of time to get our systems back up and running again. And while we haven't resumed new author submissions just yet, our intention is to do so in the near future, once we've had a chance to address the articles in our pipeline. Next slide. So beyond author papers that are currently in our system, I know that many questions have come up also about how we plan to maintain and grow the journal. So while it is true that the termination of USAID funding in February did place the journal at risk, we at CCP, took a really close look at the importance of the journal, and we recognized at CCP that this journal was an important global good. And so we are really excited to affirm our commitment to maintaining GHSP. So how exactly are we going to do this? Well, we've spent some time over the past several months creating an in-depth business plan for global health science and practice. And it includes us exploring different revenue generation models to make our Diamond Open Access model more sustainable. And for those new to the term, Diamond Open Access means that it's free to both readers and authors. So most open access journals charge article processing fees to authors to cover their costs. And we really want to avoid this because for many reasons, we don't think that this is an equitable publishing model. We also recognize that the publishing industry has developed some innovative models that move away from individual author fees. For example, there's things like subscribe to open and institutional publishing agreements. We are really keen to explore these types of innovations to find the right mix of revenue generation streams, whether that be through institutional sponsorships, perhaps advertising, also publishing supplements, which we've always done in the past and will continue to do. We're also really excited to work on developing new innovative models that work specifically for Diamond Open Access journals. And we are looking forward to collaborating and potentially partnering with other Diamond Open Access journals so that we can work together to find new ways of doing business for journals that have this same ethos and mindset. So by working with other like-minded Diamond Open Access journals, we also aim to achieve economies of scale to reduce operating expenses and streamline costs without compromising quality. We actually think our costs have been relatively modest. And if you look at our cost per article access, it amounts to about 30 cents per article access. And so we think that is a good investment. One way, though, that we can streamline costs even further is by moving to open source technology to host our journal platforms. So some of these longer term opportunities, like shifting fully to open source technologies, setting up networks of Diamond open access journals, and establishing sponsorship relationships with institutions, admittedly, they will require the support of some upfront investment from donors, because it will take a little bit of time to develop these systems and relationships. But we're confident that with the right supporters, we can achieve a return on that investment that will benefit not only GHSP, but other open access journals as well, and also just more broadly, the open science and knowledge movement. Next slide. So why should donors and even individuals, why should you invest in GHSP? As Steve mentioned, we know that there are many journals out there and many health journals out there. What sets us apart from them that makes us a worthwhile investment? Well, we'd like to highlight three key things. One is that GHSP does provide an equitable publishing platform for all readers and authors, regardless of their geographic location, their professional status, their organization. And in particular, it actually prioritizes authors and readers from low and middle income countries, the global majority. We also provide rigorous, high quality peer review. This is actually something that comes up repeatedly in our author surveys. Authors always commend us for the high quality peer review, and they recognize that it's different than other journals. We really make a concerted effort to find experts on a given topic with program implementation experience in that particular country to serve as peer reviewers. So we have a very wide network of peer reviewers that we reach out to. Similarly, we provide personalized guidance to authors among our editorial team. Sometimes this happens even before peer review. It also happens after peer review and throughout the editing process. So our editorial team is super dedicated. They meet weekly to discuss the merits of articles, and they do this because they want to ensure that we're publishing useful content that benefits implementers and healthcare providers and donors across the board, so that we can avoid reinventing the wheel and we maximize the investment in health services and health programs. And because we don't charge article processing fees, we don't have this pressure to publish as many articles as we can to make a profit. So ultimately, donor support for GHSP is a commitment to the global public health community, with a particular prioritization of voices from the global majority. Next slide. So how can you help? CCP is committed to maintaining the journal, but we are also acknowledging that we need everyone's help and the help of the community to support us. So if you are part of a foundation or an organization that wants to take advantage of this pivotal moment and support GHSP to advance the science of open access knowledge, please reach out to CCP's business development team to discuss the opportunities in more detail. We also have launched a fund for individual donations, however big or small, to help keep GHSP open. And so we have a website. You can go to the CCP website to make a donation. And we're happy to share that just last week, we were able to add global health science and practice as a particular gift designation option in the dropdown on our donation page. So you can be assured that your donation will go directly to keeping GHSP open. And a big thank you to all of you who have already donated to this cause. Beyond monetary funds, though, you can support GHSP in other ways. We're using this Keep GHSP Open hashtag on social media and asking for our readers, our authors, our reviewers, our editors to share their stories of how GHSP has made an impact on their work. And we've already seen a lot of stories shared on LinkedIn and other social media platforms, and please keep those coming in. Finally, if there's someone in your network that you think could be a good contact for us, we'd love an introduction. We are really open to sharing ideas and learning from others. We've had many conversations in the past few months that have been really fruitful and helped open our eyes to, new solutions. So even if it's like, hey, have you reached out to this group yet? They seem to share similar goals as GHSP. We'd love to hear those ideas. So please reach out to our editorial office, and our email is there on the slide. Next slide. So with that, that concludes the presentation portion of our webinar, and I'd like to now answer some of the audience questions, and I'm going to start with the common ones that were submitted during Zoom registration, and then we'll take some of the ones that have come up in the Q&A. So on the next slide, are you still processing my previously submitted paper? Yes, we are definitely still processing your previously submitted paper if you had submitted it prior to the stop work order, and as long as you haven't withdrawn the paper from us. On the next slide, do we have to restart the process, or do we pick up where we left off? You do not have to restart the process. We're not going to start from scratch. We're going to pick up exactly where we left off previously. Next question is related. Well, if you're still processing my paper, how come I can't see the submission on your platform? And we really apologize for this. What happened is when we turned off the feature to not allow authors to submit new papers, it inadvertently was connected to authors seeing their existing submissions. So that's why you can't see your existing submission. Rest assured that as editors, we can see the submission in our system, and we are trying to find a workaround to this issue. In the meantime, feel free to reach out to me, and hopefully by the end of next week, I will be sending out emails confirming to authors that their paper is still in process and where exactly it is in the process. On the next slide, we keep getting questions as well as when will you start accepting new submissions? And we don't have a specific date just yet that we can share with you. Once we address the papers that are currently in our pipeline, we will plan to restart author submissions, and we will definitely send an update to our GHSP mailing list once we've reopened author submissions. And if you're not already getting our emails, you can subscribe to our mailing list by following the directions on this slide. And we will be sending these slides out as well after the webinar. Next slide. Are you charging author fees? We are not charging author fees. We are exploring different models right now to avoid having to charge author fees. Next slide. And can I be considered for a peer reviewer role? We would definitely love to expand our peer reviewer database. And so we have a form. And if you can fill out the simple form, we will match you up with your areas of expertise with the manuscript submitted to us and reach out to you if we have a match. So next, I'd like to take some of the questions that were put into the Zoom chat. So first up, there was a question about, would you like to broaden the base of your editor and reviewer base as done by most modern journals, such as PLOS and Frontiers? So for that, maybe I can punt that to you, Steve. Steve, would you like to take that?
Yeah, I mean, the answer is, yeah, definitely yes. I mean, if you're interested yourself in getting involved, like if you haven't been a peer reviewer for us before, kind of let us know and your particular areas of interest. If you're interested, I mean, we're still feeling our way forward, and as far as what our process will be. We've had a core group of associate editors of about 8 or 9 people. Potentially that could be expanded as well. So, I mean, certainly if either of those roles are of interest to you, let us know. I mean, similarly, if there are people within your network who could be interested, let them know too that we're interested in hearing from them.
Thank you, Steve. And also just to point out that we have been broadening our editor base as well. As noted during our presentation, we had added 2 new editors in the recent years. Susan Ontiri is one of our new editors based in Kenya, and we also have Rajani Ved from India. And we hope to continue broadening that editor base in the future. The next question is, there's a groundswell of dissatisfaction with the broken peer review model. CCP has always been known for innovation in its offerings, and what is CCP's vision for how we might represent a truly evolved business model that balances equity, representation, and fairness and responsibility? Great question. So I was wondering, Susan, if you wanted to take that. Or perhaps Steve.
Okay, I can take a shot at that. Certainly, peer review is a really important part of kind of what gets useful material out there. To date, as was mentioned earlier, how our peer review process is different from other journals is that we're not just tapping academics. Like it's been very important for us as papers are reviewed to get perspective from people who are very familiar with the programmatic and health systems issues and who are familiar with the country context that these papers are coming out of. So we have been tapping a somewhat different profile of peer reviewers. That having been said, global health science and practice has kind of existed within, you could say, the official development assistance for health world or the technical assistance world. And as I commented at the end of my earlier comments, I think the world is evolving. Global health is not the same as it was even a year ago. We're moving in a direction where the big development assistance players are going to be playing a smaller role, and where national governments and other national institutions are going to be taking on a much more prominent role. So I think it's going to be important for us moving forward that we have good representation among our peer reviewers, from that space, and again, not merely from the development assistance world.
Great, thank you, Steve. And just to add to that, GHSP operates a double-blind peer review system, and we know this is a little bit perhaps seen as old-fashioned. We know there's new and more innovative ways of peer review, but we actually have received lots of positive feedback about our double-blind peer review model and how it's really provided useful and quality reviews. And we think this is because it takes away some of those biases in terms of peer reviewers who might know authors or vice versa, and addressing feedback in an appropriate way, or providing really critical feedback sometimes, which is necessary to improve papers. That said, we will be open to considering new models if need be over time. Okay, next question is, how does GHSP ensure that the evidence it publishes reaches practitioners at the community level? So really good question. And, I would say that GHSP eliminates barriers to sharing knowledge in the scholarly global health publications while prioritizing practical health program implementation evidence and experience from the global majority. So we definitely remain committed to open access principles in practice. And these measures ensure that the knowledge in GHSP is available to all. So we also hope to formalize mentoring programs that really connect experienced authors with more emerging voices in health programs, and directly support capacity strengthening in publishing. At the same time, too, we also depend on our readers and authors to serve as intermediaries and can hopefully be able to help translate some of the knowledge from GHSP articles into different formats that may be more accessible at the community level. And we also hope to be able to do more of that in the future as well, repurposing articles into different formats that can reach, further and further out into the community level. All right, next we have like maybe one more minute. So let's see if we can take one more question. There was a question around, does GHSP have options for publishing journal supplements and what are the requirements for a supplement? I think I noted briefly that we have published journal supplements. Always we've published usually about 1 to 2 supplements per year. These are sponsored supplements, so there is a fee to publish supplements. We have a process and we're working to update our guidelines for supplements. But typically there's some guest editors and they work very closely with our editor-in-chief and our associate editors. And, you know, we can publish those batch of articles together as one cohesive supplement. So we do continue to plan on doing that for GHSP moving forward. And with that, we are at 9:45. There are some additional questions that we haven't been able to answer, but we have made note of them. And when we send out the webinar recording, we will make sure to provide written responses to all the questions. And again, we really, really thank you for joining us today at this webinar and for helping us to relaunch GHSP. We continue to thank you for your support and for your patience. And we really look forward to the next, next several years with GHSP as well. And look forward to having you continue being part of our readers and our authorship. Steve, did you want to say any final words?
Nothing further on my side. Thank you, Ruwaida.
And Susan?
To nothing on my side, but looking forward to continuing engaging and also receiving those articles as we further information out there.
And Debora, final word from you.
Just thank you all for joining us for a little bit of your time today. I know everyone is busy. We really appreciate it. I also am enjoying to see the wonderful comments and support that we're receiving, and we look forward to connecting with you in different ways as we proceed with our journey with the journal. Thank you.
Thank you, everyone. Have a great rest of your day, and we'll be in touch.